Well, good morning. I hope everyone is doing well. I am excited to be here and be with everybody. I see folks joining us from all over the country, and that is so very exciting. My name is Margaret Mitchell. I'm President and CEO for the YWCA of Greater Cleveland, and it's a real honor and a delight to be with you this morning. We are here for Go Live for Equity, and this is our first session. We thought we would bring this session to you after our 21-day challenge, which we hosted on March 1st through the end of March, and you can still find that challenge on our website. Our 21-day racial equity challenge is really designed to build our social justice muscle. We had over 3,500 people taking the challenge with us this year. It was very exciting. We set our big topics probably 6 months in advance of the challenge. And this year we focused on voting, criminal justice, education, and of course, public health. And we had no way of knowing how topical all those issues were, although I have to say that the issues were certainly very topical for us. And of course, today we want to continue the conversation, which is why we have brought everyone here today, because we know how important public health is, and we want to make sure that we all come away from this conversation with a clear understanding of structural racism and its impact on public health. Certainly COVID-19 is shining a very bright light on that today for all of us. So today joining me are two friends, two amazing women. And I'm going to introduce them shortly. I want to make sure that you know that this is an interactive session. We are going to have questions. A lot of your questions will be answered, but we also want to be able to pull questions forward. So joining us today will be an amazing woman that I am excited to introduce to all of you. Her name is Ivanka Hall. She is a speaker, an activist, a friend, a director of the executive director of the Northeast Ohio Black Health Coalition. She speaks all over the country. She is nationally recognized as an expert in racial disparities and engagement, how to engage the African American community. She is amazing, and I'm so excited that you're going to have an opportunity to hear from her. And also with us today is another amazing woman. Both of these women are just badass warriors, and with us is Danielle Sidnor. She is president of the NAACP here in Cleveland. She is also vice president of the nationally for the Next Gen NAACP Association Alumni Council. She is the executive director in the state for the ECDI, which is the Economic Community Development Institute. And she's been in this fight. She is not new to this, as we like to say in the YWCA. She is also true to this, and it's a delight to have Danielle Sidnor with us today. So we just thought we would get started and jump into the conversation. I first really want to just frame up public health. I think a year ago, when we all started talking more deeply about public health, I felt as if folks sort of didn't really have their arms around what public health in fact is. So I just would like us to just sort of begin with breaking down what public health is. Ivanka, do you want to
Oh,
jump us off?
okay. I'm like, okay, do y'all have me on mute? I see these other kind of little surveys popping up. So
Right.
public health is our challenge to make sure that citizens in communities actually have access to the best quality around health access, around education access, around employment access. All of those things are combined under the umbrella of public health. So whether it's air quality, which we look at a lot of times when we're talking about our community, like what's going on with the air, whether it's housing, whether we're looking at the structures that we live on the outside, the neighborhoods, all of those things are the issues around public health. The other thing around public health is disease, making sure that we're looking at the impact of HIV or other chronic conditions that are impacting our community, or making sure that children are getting their vaccinations. You know, all of those things are a big part of public health, or if they have a crisis. So we may have something that comes into our community, here go a virus, or we may have some other type of like food poisoning incident that took place. Public health steps in to make sure that the community gets the services that they need, that they get the testings that they need, that they get all the information that will help them get from point A to point Z. And we know that for African American community, sometimes at point A to point Z is like jumping over landmines. And so public health is supposed to be there to make sure that those access points are all connected.
Yes, public health is really designed to be a system that should have equity. It should have fairness. It should be inclusive. It should be empowering. And yet we see a public health system across the country that is not those things. You know, it's really important to understand structural racism. I think we throw that term around so often, Danielle, that people don't fully understand all of the real layers, barriers, and obstacles that comprise structural racism.
Yeah, you know, Margaret, I want to say thank you for providing me an opportunity to participate, you know, in this conversation. And we've been working on this together in City of Cleveland, you know, to designate racism as a public health crisis. And so I think that all of the things that, you know, we've been all working on together over the last year have really been illuminated, especially as a result of COVID-19. And so I think this crisis has helped to clarify what structural racism is, because oftentimes it's easy to identify racism as a certain act or a type of language. But when you start to talk about structural racism, it helps people to understand the bias that's incorporated in you must have a vehicle to drive through a drive-through COVID-19 testing center. And so we know that transportation is often a significant challenge in communities of color and low to moderate income communities. And so systems are not designed for people that often don't have privilege, or you must contact your primary care physician to get a referral for a COVID-19 test. Similar type of scenario. We know that many times in our communities, folks may not have consistent healthcare access, and that means that they don't have a primary care physician. That means they go to the back of the line when it comes to testing. And so it's unfortunate that this pandemic is the tool by which people are becoming more aware of structural racism. But I think because of folks like you in leadership that are saying, if we don't take the time to identify these things in this time, I don't think we ever will. And so I commend you and your leadership team for pulling this together and really using it as a platform to really illuminate the challenges that we know persist.
Thanks, Danielle. You know, Ivanka, there are so many myths. There's a lot of mythology around access to public health, and a lot of mythology around what I call really blaming the victim in terms of those, you know, the people, those Black people have these disparities because of what they're eating or not exercising, just sort of all this mythology. What really sort of drives you crazy about what you are hearing, even today, recirculating in the media from you know, high-profile folks and others about this mythology?
So again, I didn't get a chance to thank you for having me on and having the Northeast Ohio Black Health Coalition on in the NAACP, which I've done some work with them. I actually was their health director for some time, probably 20 years ago. But for me, in my organization, it has always been important for us to look at like all of these overarching things. And so the reason why we look at education, employment, housing, and health is because in the African American community, if you have one system that is awry, then all of the systems start to tumble down. And so what happens is we have these systems that the brick and mortar is tainted. And so now we try to add layers to these systems of something that's already on shaky ground. And so this is like the way where people kind of like fall through the cracks. And so for us as a whole entire community, we have fallen through the cracks. So no matter whether you're talking about the cradle to the grave, African Americans are disproportionately impacted. And so with COVID, what COVID did for us, so I've been screaming about this. I've been doing this work for 26 years. I started off doing HIV work as an HIV researcher some 26 years ago, and looking at the disparities that existed then and saying, as a young person saying, okay, what the heck is going on? Like, why aren't we able to talk about these things? And so what COVID-19 did was COVID-19 was able to shine a light on all of the social determinants of health, the problem of systemic issues centered around access, accountability, racism, in education, employment, in our housing and health. So right now, basically, people can no longer jaw jab about all the great things that have been done for Black people while stepping over the bodies in the street. Like you can't say, oh, our system is so great, like we have watched out for you while we're stepping over people's bodies, while we're looking at systems that are just totally in shambles. So African Americans have more circumstances that make it harder to survive this pandemic. They're deep rooted around poverty, pre-existing medical conditions, less access to healthcare. Danielle, thanks for that analogy around this line, because that's important. Like I don't, you said get in the back of the line. I'm like, you don't even get in the line. Like there is no line for you. And we have less stable employment, lack of transportation, racial segregation. All of these things have contributed to our disparities in our communities. And so whether we're looking at this pandemic or whether we're looking at infant mortality or whether we're looking at our poor educational systems, all of these things impact people's health. And I think for the first time, no system can tell us that that they have watched out for our best interests, because we've been screaming about this. Like for me, it's been 25 years of saying the same thing, basically being told, okay, girl, just wait your turn. And it's like, well, when does my turn come? Because my grandmother was waiting her turn and she's 89. And so for our community, we can no longer afford to wait our turn. So we have to use this opportunity to not only shed a light, but to force them to see the light around the issues that are impacting us every single day.
Amen, sister. You have been in the fight for such a long time. We are all finally just catching up to where you have been. And so I'm so appreciative of the depth and breadth of the work that you have done. It's just really been a wonderful thing. And yet I'm really, yesterday as I was preparing, I had a moment in which I realized that there is loss of life within our community and across the country. And it is a real sacrifice. Every single time we take a giant step forward, there is significant loss of life. And it just feels to me as if we should not take this lightly, that we've got to be able to really move this issue forward, declaring racism a public health crisis, demanding equity within systems, all the systems you mentioned, housing, education, employment, is just so vitally important. And that is what we have to do in order for, loss of life and loss of job, not to all be in vain. Do you know what I'm saying?
Well, every day.
Yeah.
Yeah.
Yeah. Sometimes when we talk about access to healthcare, it can be very subtle. It does not, I think where people go in their heads is, people can't get there, although that certainly is a piece of it, but it's also subtle. I was reading a report of an African-American woman, I believe in Cook County, that died of COVID-19, and they called the ambulance several times, and the ambulance team, the EMS team, was very dismissive of her twice.
Mm-hmm.
And so access is far more subtle than we often can understand.
And like I said, COVID-19 basically, it shined a light on what we've been talking about. So I worked in the healthcare system for 10 years. So as a person who worked in the healthcare system, I got a chance to see firsthand how the system works, reacts, is reactive or not to our issues that impact us. So we know that if African Americans are having a stroke, for instance, an African American woman goes to the doctor, an African American man goes to the emergency room. And so the stroke, when you're looking at a stroke, and this is stroke month, so when you're looking at the symptoms of a stroke and inebriation very mirror, like the speech, the slurred speech, the walking patterns, all of those things. And so what happens is when African Americans present with a stroke, they're more likely to be sent home, and they've had a stroke. So case in point, I have an uncle who is now deceased. My uncle had a stroke about 10 years ago. And I went to the doctor to pick him up the first night when it happened. I got there to get him, and we walked out. He said, "I'm hungry. I've been here all day." I said, you had diabetes, like they didn't offer you any food? And he says, no. But he also had a mental health condition. So remember these that we all have these comorbidities that for the African American community, we have a lot more than everybody else. So I took him to get something to eat, and I said, "Give me your medical record. Let me see what they diagnosed you with." And so I looked at his medical diagnosis, and he was diagnosed with acute intoxication. That was his diagnosis. So a couple weeks later, I got called to the same hospital from my grandmother, who said, "I need you to go and see about your uncle." So when I got into his room, he started talking to me, and I'm like, "Oh my God, like you are having a stroke." I ran to the front desk. I told them to immediately give him TPA. And because and I'm like, "I'm getting his medical record sent over to you right now." My uncle, they were getting ready to release him, and he had a stroke. He had not only had a stroke, he'd had a massive stroke. And he was kept in the hospital for 3 more weeks. And so what happens is we have these systems that look at us as less than people. And so if there hadn't been anyone else coming in, if it hadn't been a white male coming in with slurred speech, with vision issues, kind of stumbling, they would have immediately started talking about strokes. But because he was a poor African-American man who had some mental health challenges, the first thing that they said was, "You're diagnosed acute intoxication is your diagnosis." And so we have to demand that our medical systems provide us the services, not race-based, but health-based. So you need to make sure that whatever is the diagnostic that's supposed to take place if I'm presenting in with these issues, that you run all of those tests pertinent to what I'm coming in with. This young lady was coming in with breathing issues. She already had asthma. She had some other lung impairments. She should have immediately been tested for COVID, immediately, particularly with what was going on in that community. There should not have been a question. And she was a teacher, she's 30 years old. So it's important for us to demand that our healthcare systems and practitioners not just talk about cultural competency, because I think that's the other word that we throw around all the time. Culturally competent just means that you understand how systems work. Cultural competency is understanding systems. So what I want people to do is I want people to be culturally proficient. I want them to understand people. I want them to understand how people work. And we have so many systems that are saying they're culturally competent, but they are culturally insufficient and non-proficient. So they need to make sure that they're understanding what's going on in the minds and lives of people.
And Margaret, I would add to that, you know, when you look at the importance of all that Ivanka just talked about and saying, how do we demand real-time information? You know, we are in a day and age where you can walk down the street and something can scan your face and they can know it's you. And so if we have that type of advanced technology available, there is no excuse for us not to be able to know the number of individuals that have tried to gain access to these systems that have been denied tests. Facilities should not be able to pick and choose when they provide this kind of detailed information, because when you talk about starting to try and attack the systems, a part of it is people don't believe us to begin with, right? When we say that these comorbidities exist and there's the disparities and social determinants of health and all of this, but you cannot argue with data. And so what I think we have to be demanding in this day and age is that it's not an option for them to gather this type of data on individuals, so that way we know the number of Black, individuals who have tried to gain access to testing and been denied, or who have gone into the system and not received a trach, been put on a ventilator. Because when you start to think about the limited resources that hospitals have, if I only have 3 ventilators left, and I have 3 poor Black men who may need this ventilator, and I have 3 affluent white men who need a ventilator, if I'm allowing human bias to go into that scenario, and I look at that person and I'm a white male doctor, do I see this man looking like my grandfather and decide that he gets a ventilator? Or do I give it to the poor Black man who I think maybe is, acutely intoxicated, right? And just in the scenario that Ivanka gave. So I believe that a part of this is to hold these systems accountable. We also have to demand that we get real data, and it does not become an optional thing, but it's a requirement, especially as these government entities still rely on additional resources from a federal level. We have to be advocating even locally that this is a part of just standard practice. They must collect data and they must report it back out.
And I think that's important too, around that data for us, because, one of the things that we talk about is this aggregate data. So the aggregate data just tells us what our numbers look like. But when you start breaking it down and you do the disaggregated data, then you're able to say how many Black women, how many white women, how many white men, how many Black men are impacted by this, and then where they live, what's their income. Like you're able to kind of drill down. And that's one of the things for us. So at the state level, they can tell us how many Black people are impacted, which is absolutely bizarre because they can't tell me that at the city level. So it's like, if the city and the county is feeding the information to the state, and the state has that information, then how come the city can't give that information to us? Because that information, we know that data drives dollars. So we work in a world where data drives the dollars. And so if we have diagnosis and these issues around disease, then those dollars need to be driven to those communities that are disproportionately impacted, and not driven into creating new programs that never existed before, but to fund the programs that have been boots on the ground, working our asses off for 25 years doing this work. Like, we should not be creating new programs. We should be funding what we already got.
Just on the data for a minute, I could not understand why it took so long for the data to start coming forward that was disaggregated by race. Why we have a number of strong groups of various organizations, various initiatives working, and I'm sure it's true across the country. And yet, for some reason, it felt as if we were, caught off guard, didn't understand how important it was to look at something like this through a racial equity lens. I don't understand.
We still don't have it. I mean, Cleveland is still not releasing that around race. So the state released data around race, and then they release zip code data. So they get that information from the city and the state. That information goes up, it feeds up but for some reason, it hasn't fed out downwards. So for us in our community to not know. So what I did was a few weeks ago, we're running a food program here now, but a few weeks ago at like 2 o'clock in the morning, I went through the zip code information. So I went through so myself, my team, we went through the zip code information. We overlaid it with the census tract information to figure out, what are the probabilities of folks being African American. So I live in 44128. I live in the city of Cleveland. 44128 is 92% African Americans. All right. So 44128 is one of the highest impacted areas. So I know just because it's 92% Black, that the majority of the folks is us. I shouldn't be trying to figure it out at home. That data should be released to the organizations that are boots on the ground so that we can go into those zip code areas and get them the services that they need. Because the probability of someone living in a zip code area and the probability of them being impacted, and then they're going out every day to the store, they're going out into the neighborhoods, into the community, they don't have masks. Like, those are the things that need to be given to those communities to make sure, and then more information needs to be given to them to talk to them about the spread, because people still are not believing this. And that's because nobody has come down to them and said, this means you need to wear a mask, you need to wash your hands, and you need to social distance. So no matter how much we say it, it needs to be said in our communities, to the homeboys standing on the corner, to the guys walking down the street, that are living with their grandmother, that y'all out hanging out. But when you go home, you can take this back to your grandmother and she could die. And she's the breadwinner. What happens when we have communities with young people who are being raised by grandparents? I was raised by my grandmother and my grandfather after my mom was murdered. So if something happened to my grandmother, where am I going? I'm going into a system. And so we have to really, as a community, understand how this impacts us, top down, bottom up. Like, we need to make sure that every facet of COVID-19 and how it impacts our daily lives, that the community understands it for them also.
It's this lack of information for our community is really tragic, and we can all be a part of communicating with the public health department and others, our city officials, and demanding that we see this disaggregated data because it is very important. It's very important that we use our channels, Facebook, whatever it is you are using to communicate these days, to talk about these issues with our family and our friends, just the seriousness of this, disease. And, what else are we needing to do in order to, demand? Sometimes I feel like, the crazy Black woman, because I feel so passionate about this. And yet here we are. This could have rolled so differently, had we been able to communicate in a way and demand in a way, disaggregated data, understand the impact that was coming. This was a freight train coming at the Black community.
Yeah, Margaret, one of the things that I think is interesting, I was having a conversation with a friend yesterday about the fact that the main mediums that are being used to communicate with the community right now, you have the governor that does his 2 o'clock briefing. Well, there are many in our community who are not watching that, right? Who are not seeing the updates every day from cleveland.com. And so thinking about how we tap into our local elected officials, our local CDCs, local small businesses and organizations, and provide them with resources to be outlets of, the data that, Ivanka is talking about, and even pushing messaging out continuously over and over to people to say that the numbers of deaths have actually increased. So maybe in your immediate neighborhood, you don't know anybody who died, but again, in 44128, we now have this increased number of individuals that are testing positive for the virus. So I think we've gotten to a place, and this also was really illuminated as we looked at the impacts of the election and how we had to try and quickly pivot to get people access to vote by mail ballots and things like that, we've relied on certain types of systems over the last several years to really be able to kind of carry messages for us. And I do believe that we have to go back to some of our grassroots organizing. You know, we were talking about the fact that the March on Washington was organized before cell phones, before the internet, and you had how many, you know, millions of people show up. So we've got to get back to family captains being the ones that are responsible for your immediate family, calling and telling and spreading the good information. And I think that that was something we also learned in this, is that when it first came out, there were a lot of us that said, I will admit one of them, like, oh, Black people aren't getting COVID-19, just because the first, you know, few reported cases and incidences were in China and in Europe. And then we started to see it permeating through the Black community. So I do think it's important for us as leaders to be able to say, what channels do we already have to have access points and connections in our community? How do we advocate? The governor has put together, at least in Ohio, the Minority Strike Task Force to say, you need to fund this task force to put dollars into organizations like the Black Health Coalition, who can get maybe literature out. If people are still ordering takeout from places, they're going in grocery stores, can we put a slip of paper in everybody's bag that says, here are the symptoms, know the symptoms, wash your hands, do these things? Because they may not watch the press briefing. They may not be reading the New York Times every day and seeing stories of the 30-year-old person who was seemingly in good health that all of a sudden died from COVID. So I think we do have to fight and push to get messages out in a way that we know work for us. And then the other thing I think about the data point that, you know, both of you have raised is there were a lot of individuals initially as well who just believed that this virus was going to be the great equalizer. And I kind of feel like it was the same thing that started happening when we had conversations about the opioid crisis. It was the great equalizer. And we're like, hey guys, no, it's not. You know, those of us that have been in this work know that anything bad that happens, you know, is going to be worse. And when you talk about old people say, when someone, if America catches the cold, Black people catch pneumonia. And in this case, like, it's really happening, right? And so we knew that this wasn't going to be an equalizer. We knew it was going to illuminate disparities. And so I think, again, being able to just reinforce that, be the angry Black woman when we need to, be the crazy Black women that say, I know people in my community, there's too many people close to us that are being disproportionately impacted by this, and we cannot wait for people to try and figure it out. We need to reinforce that there are folks that are already on the ground that have been underfunded to deal with this, and we need to provide appropriate funding to be proactive. Otherwise, the state and the government's gonna pay for this stuff on the back end when unemployment continues to increase, when families don't have access to food and need more health benefits and food benefits. So they've got two choices. We either help it on the front end or we're gonna pay for it on the back end.
Yeah,
you said something for real, in terms of utilizing the grocery stores and disseminating information through that way. That, I think that is just a viable action step. There has got to be somebody on this meeting who has access or the abilities or the printing or the relationship. We need to make that happen in our community or whatever community you are in. That is just a solid idea. That is a giant step for us, and we need to move on that. We'll certainly, you know, at the YWCA continue to communicate that and help people to get that moving and to encourage grocery stores, you know, to do this, because I love that.
Yeah,
and
plus, you know, grocery stores are our shopping malls right now. Like, grocery stores are busier than malls. You know, grocery stores are the busiest place in the community. If you go to a grocery store right now, the parking lots are jam-packed, and they've been jam-packed for 6 weeks. You know, and I think people have been like kind of riding the African-American community about the fact that, you know, grocery stores are so packed. But when you have food insecurity, when you have financial insecurity, you get money, you get food as much as your $20 takes you. And so if that means I'll have $20 a day and I might have another $20 tomorrow, then that means every day you're at the grocery store. And so we need to use the grocery store is our partner, is our community partner, is our boots on the ground. And so if we're talking about utilizing our boots on the ground, they are our boots on the ground, because everybody, you know, like Danielle said, everybody isn't listening to even to the radio. You know, like most people listen to podcasts. They don't listen to, traditional radio. They're listening to their Bluetooth and other things like that. Like they're not listening to, a lot of these radio stations. They're not looking at regular TV shows. They're looking at things they can pull up different ways, and they're pulling up movies. So we have to have communication strategies in a way that meets our folks where they are. So back in the old day, when people were running for office, they would ride through the neighborhood with bullhorns. So they had these
That's right.
bullhorns on cars.
That's right.
They would go
Yeah.
through and say, you would hear it all day Saturday, like vote for me, vote for me, vote for me, like, and it would be a continuous loop. And people, we need to go back to that. Like if that continuous loop from people hearing that all morning, all the way to the evening,
Yes.
they're hearing, wear your mask,
Yes.
social distance,
Yes.
wash your
Yes.
hands. If they're hearing it, the more they're hearing that
Yeah.
message, then it makes it real for them. Because I think the other thing too that we talked about early on is that African Americans really did think that this did not impact them. So we had this whole misnomer about, it don't impact you. The other thing was Black folks started saying Jamaicans couldn't get it. Or if you drank Jamaican rum, you could actually kill the virus. So all these people like Jamaican rum companies was like loving it, but it's like, no, it doesn't work like that. And so we were doing all these other things because we're not getting the right information. So when you have misinformation or no information, you start doing the things that you hear other people talking about. And so it makes it easier for our communities to become preyed upon.
So I want to just suggest that the three of us come together to put a one-pager. Ivanka, I know that you can make sure that all of the information in this one-pager is accurate, and we will have it as a download on our website that people can download, and even 50 cars at a time, drop leaf in grocery stores. I know we can do this, right? Can we do this?
Yes, and I think that there are other partners, Margaret. If we have a quick plan that we put together that would be willing to jump on and help us disseminate as well. We participated this past weekend with an organization that's newly launching Mask for the Community with the number 4, so Mask for the Community. And while we were collecting vote by mail ballots, we handed out a hot breakfast and a free face mask. And we had folks that were stopping by just to get a mask. And you think about this belief that it's easy to obtain them. Well, it's not. You can't walk into many stores and just go buy them. And yeah, you can make your own homemade bandana and things like that, but there are folks that don't have those resources and, don't want to go out looking crazy with something that they just put all over their face. And so I think there's a lot of things that we could do with other partners as well that are interested. They may not have as large of a reach as our organizations do. So I think us kind of pulling together and collaborating. I mean, listen, how many people you were able to get onto this webinar today? That speaks volumes to the reach. And so we've got to tap in and plug into the communities that we already have access to and pull in more partners again, so we can have that grassroots organizing type of method.
And then even with the food banks, we have the food banks gives out thousands and thousands of boxes, every single week. For my organization, like we're a small organization, but actually every 2 weeks on Sunday, we've been taking food out to disabled students and disabled caregivers. And so we send out, in a month, we send out 4,200 breakfast, lunches, and snacks. So on this Sunday, when we send out everything, we'll send out 2,100 breakfast, lunches, and snacks will leave out from my house. And so, like I said, we have some community partners that we could actually, work with, people who are providing food, the food bank, the grocery stores, the places that are busy, the gas stations, because people are still driving, making sure that information gets out to people where they can read it in real time, because I think that we have too many people that are totally ignoring this. And, I had a girlfriend who just turned 52. I've known her since elementary school. And a couple weeks ago, starting in like early January, she started having some medical issues. She always had asthma, and she was running back and forth to the doctor, and they were sending her home. And so the other day she was on Facebook saying, I'm not feeling good again. And that evening her kid said, she died. She had just turned 52
my
the week
God.
before. We've
Wow.
had, you know, I know that there are other people who there was a husband and wife team that works in the community where they got sick, they went to the doctor, and they were told to go home. They had the flu, and the wife died the next day, and the
Mm.
husband died the following day. And so
Wow.
I know just by
Oh my
myself
God.
15 people that have succumbed to this virus. And so this has to be a serious issue. And so for me, I want to protect, you know, my grandmother. I want to protect our seniors. My grandmother's 89 years old. Her neighbors, you know, that are still living are in their 80s. You know, I try to make sure that they have food, have the things they need in order for them to not be out trying to get public transportation and out in the streets.
Right.
This is the best time for us as African American communities to go back to basics. The basics are watching out for your neighbors, making sure that whatever you
Mhm.
got, you're willing to share. We have to change from this whole economic based entity and go back to what we know. And what we know is looking
Yes.
out for the least of us. And we've always, as an African American community, been resilient and made sure that we looked out for the least of us.
I'm first of all, I'm sorry for your loss. This is it's devastating, and the uh, the just the loss and people being alone at that time is just so very difficult. So I just want to extend my sympathies to you, Ivanka, for the loss of your friends. And I also want to just for a moment pivot back to our system work and take a look at you know what declaring racism a public health crisis would mean. You know, sometimes people say to me, you know, like, so what? So what if that happens? What is the difference maker in your mind when we have the declaration of racism as a public health crisis? What will be different?
The thing that I think will be different to begin with is you cannot solve a thing that you don't diagnose. If I have cancer and you're treating me for high blood pressure, it's not going to solve my problem. And so to initially be able to identify that racism does actually cause all these other things is really like a basic first step. Because I believe for those of us that have been in this work, you know that there's oftentimes the argument that you started out with, Margaret, is blaming the victim and saying, if people would just do these things, then we wouldn't have these problems. So by getting on record and saying we all can agree and identify that racism in and of itself is a public health crisis, then we can begin to work towards the solutions that we've also been advocating for, with at minimum a foundational agreement that racism is an underlying cause of many of the things that we're challenged with in our communities. Because I feel that many times we attack the symptoms of racism, and those symptoms are poverty, those symptoms are social determinants of health and all of those. But if we don't attack the root cause, which is racism, we're essentially putting, again, a Band-Aid on a situation that might need stitches, and we're not going to come up with the solutions, or not necessarily we have the solutions, but we won't get to the outcomes, you know, that we're looking for. So I think it helps us to not allow people to claim ignorance to this problem, because I believe ignorance has been a privilege for many in our community who have said, well, I didn't realize that. Well, now, again, with this declaration, you will not be able to use that as an excuse. So I really pray that it helps to advance our work much more quickly. We know it's not a silver bullet, but again, it starts to eradicate some of the things that have been able to kind of be in the closet and hidden, that will now have to publicly be brought to light.
And not only be brought to light, I think, Danielle, too, is we have been in a community where we have continued to put band-aids on bullet holes. And
Mm.
so what happens is, you know, every 3 years we get funded for 3 years, 2 years, whatever amount of years. 3 years later, the program was doing great. It was making all these strides in the community, and you yank off the band-aid on the bullet hole that was never fixed in the first place. And so what happens is the community slowly starts to bleed to death again. And it's like, it's not that the bleeding ever stopped. The Band-Aid just slowed it down. And so what we need to let them know is we will no longer let you patch up our community with the pieces that you feel are vital. But
Right.
now the data says this is what you're going to do because this is what has, this whole system has eroded. The system never worked for Black people. Okay, let's get that together. This system has never worked for Black people. Like in the last 50 years, we've lost more economic advantages than any other time. Like we've lost house, we you know, our juvenile systems, our educational systems are all eroded. So we have systems that are jacked up, right? And so now, look, I have to be real. I'm at home. I can be real. I'm at home. So our systems are so jacked up. And now we're saying, okay, look, y'all done jacked it up enough. You got a pump, you're putting up this tire, and then all of a sudden somebody pulls out the jack and the car falls down, and now the tire is flat again. And it's like, ours have been so jacked up that unless you do this right, when you pull the thing away from the tire, and if the tire falls back to the ground, it's going to burst open again. So we have to stop letting these systems jack us up and then pull away any supports that we had to allow us to be on the ground fighting out again. Like we have to make these systems go to their knees. Like they're good at cutting me off at the knees. So we have to cut them off at the knees and say, you know what, as an African-American community or as a community, we demand that you address the systemic issues that have been plaguing our community since 1865. Like you have to, like you expected us to walk off of plantations and die, and we didn't. So since we didn't die, and you got to deal with us, we are here, we here to stay, we ain't going nowhere, then you need to build systems and infrastructure that allow us to have parity and equity in our existence. From the birth to the cradle, from the cradle to the grave, we have to make sure that all of those systems have everything that they need in order for them to exist right.
Didn't I tell y'all? Powerful women, powerful women. That was the truth. There's nothing like some truth telling.
Right.
And you know, it's so important to be able to understand the history. You know, you talk about walking off the slave plantation in 1868, 1865, but we have to recognize just the hundreds of years that slavery existed. And then, you know, when slavery ended, we got a new deal around slavery. It changed, you know, its face just a little bit in terms of the sharecropping, and then it changed its face just a little bit in terms of Jim Crow, and then, you know, mass incarceration. We have to recognize that this was another way, particularly in the South, originally when mass incarceration really got going, was free labor. It just keeps changing itself, and we have got to come together and recognize that, you know, declaring racism as a public health crisis, as Danielle said, it names the thing in a powerful way. And from there, we can begin to insist that data like a public health crisis would automatically be disaggregated, that the resources and systems going into the African-American community would have a level of priority. You know, one of the things that I didn't mention, Danielle, is your role at Eliza Bryant in terms of, you know, a historically African-American senior citizen housing, rehabilitation, you know, and nursing home. And so when we know what's happening at nursing homes all over the country, we can only imagine that Eliza Bryant is truly struggling because of all of the realities around disparities in the African-American community that fall to bear on a predominantly African-American nursing home.
Yeah, you know, Margaret, and it's something that has really hit home for me much more intensely since, you know, coronavirus has hit. I really have had to say that every institution that I'm connected with, I really feel like is in the heart of this crisis. In my day job, I'm working with small business owners. with NAACP, we're talking about these disparities and challenges we've had around voting. And as chair of Eliza Bryant Village, there's no way anytime you have congregate housing that you're going to avoid the introduction of the virus into a facility. And so what we're grappling with now is we have to work across all these systems to also change the messaging. The reality is that we also have a higher African-American workforce as well. So our frontline workers are folks that live in the community where our facility is located. And so as they go back out into the community and come in every day, no matter how much people practice social distancing and these things, we know that there are a lot of people in the community who are asymptomatic. And so to bring it into a nursing home facility, it's almost inevitable. And that's why we continue to advocate for proper PPE equipment for frontline workers. We thank our sanitation workers who are working around the clock to continue to keep facilities clean. But once a flu virus, any type of thing gets introduced into congregate housing, you're going to have a higher likelihood of death. And so we are working to try and help families understand that we, like many other nursing home institutions, are doing everything in our power to keep individuals safe. But we do understand that until there is some sort of vaccination process to be able to help protect people from the virus, that we can be, any of us, any of the leadership team can be walking around and potentially have the virus and expose staff and other residents and things like that. So we're working very, very hard to make sure that we have all the proper protocols in place. Another thing that we're looking at is, if you look back in the 80s and 90s when there were tuberculosis outbreaks and HIV, some institutions really doubled down and tried to figure out a way to become an expert in these types of diseases and protocols, because one of the things that I'm acutely aware of as we watch some of the updates from Dr. Fauci is that he doesn't believe that this is going away anytime soon. We get into November and we have a resurgence of the virus. The organizations and facilities that have been proactive in thinking about how to have areas of their facilities that are locked down, that are more able to acutely service the population, likely will not be as caught off guard as those that have not experienced COVID in their facility at all. And then you come around to the fall and winter again, and then have a new wave of crises inside of these facilities. So it is something that is very important to us, because not only is our housing population predominantly older, poor Black people, but our facility in terms of employment is also predominantly African-American as well. So we're kind of in a double whammy situation, but we are not going to be like other facilities and turn people away. We realize that you talk about disparities. When somebody gets released from the hospital, if they have survived COVID and they're older and they're poor and they're Black, which nursing home wants to take them?
Right.
Where do they go? Right. And so you want to not expose the rest of your residents to this, but at the same time, if it was me, I would want a facility to take me as well. And so it's something that we're grappling with. I mean, our board will be getting together in the next couple of days to really just kind of talk about strategies. But this is really, again, I just keep using that word illuminate, because we already knew it was there, but I just think these lights have become much more bright and shining on the things that really cause challenges in our community. And then it's giving me hope, though, that we have forums like this where we're coming together, we're collectively calling out the problem and trying to come up with solutions. And I just commend you for providing this platform, and will continue to solicit input from you and Ivanka as Eliza Bryant is even looking at strategies that we're going to deploy, because somebody's got to take care of even our older residents who get COVID at home and need to go into a facility. But we got to make sure the community understands we're not doing bad things, and that's why people are dying, but we're also taking care of those that maybe nobody else wants to. And that's a tough position to be in.
Yeah, and even for our children, Danielle, I mean, it's, like I outlined earlier, I was raised by my grandparents, after my mom was murdered. And so if grandparents are raising grandchildren and grandparents die, what happens to the babies? And so for me, is we need to, that is a reality in our community. Like, we don't want any more children to be part of these systems. These systems are not, fit for our children. And so what happens is they end up in this very fragmented existence. One of the things that we do know about viruses, and about this particular virus, is, and with the FDA and the USDA and with vaccinations, that it can take anywhere from about 18 months at the earliest, about 2 years. So we're looking at about 2022 before we have a new normal. This is a new normal. This is not something that is going away anytime soon. And so I think I don't want them to put their guard down and say, and if they hear somebody say, oh, they came up with a vaccine or they're going to do whatever, they haven't come up with anything. And it can take anywhere as long as 18 to 24 months before the FDA and the USDA actually approves anything. And so we need to understand that the social distancing, not having a bunch of people over our houses, summer is going to be different. We can't have backyard barbecues and think we're going to have 1,000 people at our house. We have to, this has to be a different existence. And, I think, years ago, I talked about it with Generation Alpha, which are the children born between 2010 into 2025. And so those young people are the first generation that they looked at as being like the electronic babies. But this is all different. They looked at them as not being able to have like human touch. And this is like the for real deal. Like, this is like looking at what they talked about around Generation Alpha and what's going on with the Alpha generation and what's going to go on up until 2025. It's going to be hard. And so for our community who's like a lovey, touchy, feely, huggy, like for me not to be able to hug my team, and, for me, that's like a big deal. Us, being part of that team is that being able to hug folks. And so we have to think of a new normal for our community.
At a new level of existence. And I think it is extremely important for those of you who have joined us today to recognize that you can continue this conversation. You can engage in problem solving around these issues. You can be a part of demanding of our city and county politicians and elected officials that we declare racism as a public health crisis. And you can be involved in ensuring that this is not just lip service, but that we actually codify change with an ordinance. You can engage in the political system, be at city council meetings. You can be engaged with our organizations. We are here for you. There are organizations that exist to be able to help move this forward. And three of those organizations are represented, on this call. So I'm just so excited that we've been able to start this dialogue, and I look forward to continuing it. We started having this conversation long before COVID. And we will continue to have this conversation, and we're excited to be able to, really take a giant step in moving everything forward. I want to thank Ivanka Hall and Danielle Signor. I told you that they were awesome, didn't I? Just absolutely amazing. I am energized by the conversation. I promise you, we will get information up around that one pager. And I also want to ask you and encourage you to give to the YWCA. You can do that through a text gift. And it is so important to be able to support our work. Become a member of the NAACP and give there. Become engaged with the Northeast Ohio Coalition for Black Health and give there as well. And thank you so much for joining us. This has been a wonderful, wonderful way to start our morning and our conversation. Please tune in next week. We are going to talk about defending our democracy in the world of COVID-19. We have two amazing panelists with us, Devante and Marsha Maccabee and Devante Dickey. I don't know why I was drawing a blank on Devante's last name, but two just amazing folks, and another conversation that is really going to be speak truth to power around defending our democracy. So wonderful to be with you all. Thank you so much for joining us, and we'll see you next Friday.
Thank you.
Thank you.